Welcome back to Fox in the Morning. Well, most of us, when it comes to women's health, have heard about mammograms, right? But what about MRIs for detecting breast cancer? Well, joining us this morning is Dr. Elizabeth Salata with more details on an added screening that would help people, especially in the high-risk category, right?
Right.
So I actually went through this process. I went through a mammogram, and I'm very young, but there was something wrong, and then it took like 3 mammograms before they suggested, well, maybe you should get an MRI, but it's kind of a long process. So when do people know that they need to be getting an MRI as well?
Well, why did you have your mammogram to start with? Was there some question, or are you high risk, or?
I had some pain, and it was hyper, what do they call it, cystic,
like hyperplasia or something?
Cystic,
fibrocystic.
Yeah.
Okay.
So basically there was an issue, but for a lot of women, they, especially if you're young, they say, you know, you don't have to worry about a mammogram.
Well, the basic guidelines are at 40 you should start your screening for the average risk woman. So in our 40s, the American Cancer Society recommends that we start screening for breast cancer with a plain mammogram. Now, if you're high risk, that's a different scenario because a mammogram may not detect all the changes that you may have as a high risk woman.
So what constitutes high risk?
Exactly, that's the question. So once we hit 50, our risk for breast cancer increases. About 77% of women over 50, about 77% of breast cancers are found in women over 50. So it's important to screen as you age. Women with first-degree relatives, so if your mother or your sister or your brother have had breast cancer, that puts you in a high-risk category. Certain genetic conditions will put you in a higher risk category. If you have dense breasts, you're considered a little bit higher risk because mammograms it can be difficult to find breast cancers in women with dense breasts.
And that was my issue, and they couldn't figure out what it was.
Exactly. Okay. So you went on, which is what's appropriate, is you start with a baseline mammogram and add to it an MRI if necessary. An MRI is not a good substitute for a mammogram because an MRI can miss minor calcifications, where mammograms will pick that up. But an MRI is now recommended in addition to a mammogram for certain women in a high-risk category.
So people are more open to giving women MRIs. But this process can also, it's very simple, but it can also be quite expensive. So that's why a lot of people, doctors don't necessarily recommend them right away.
Right.
But a woman may want to feel extra sure that they're getting the screenings that they need. What do they do?
Well, what's interesting is that you can still go and pay for an MRI. It's expensive, but if you are just really curious and want to know, I've had several women ask me, just write me for the MRI. I'm concerned. I have dense breasts. I have family history. Oftentimes, insurance will cover it. If not, some women want to pay for it, and that's fine.
So you need to check with your insurance company, because depending on your risk factors, they may evaluate whether you need one or not.
And there are some tools now on the internet through the American Cancer Society's website that will talk about profiling your risk. So if your lifetime risk of breast cancer using one of these assessment tools is between 15 and 30%, most insurance companies will authorize you to get an MRI in addition to a mammogram, because it takes into account the age when you've had your first baby, it takes into account how old you were when you've had your first menstrual cycle, it takes into account your family history. There are some genetic tendencies with breast and ovarian cancer. So the models that are out by the American Cancer Society take into account all of those, and then they come up with a percentage of risk. The average woman is 10 to 12% in her lifetime. If you're in the 15 to 30% category, you are going to qualify probably for an MRI that your insurance may cover.
Talk about the MRI for people who aren't familiar with. How is that different than a mammogram?
It doesn't use radiation. It uses magnetic resonance imaging, which is a technical term for using magnetic energy. It's not radiation energy. It takes longer. It takes about an hour to image people, which a mammogram takes 10 or 15 minutes. So that's part of the cost factor, why we couldn't use mammograms right now for screening, because it is time intensive. And it's not...
I mean, you can't use MRIs right now for screening.
Exactly.
Yeah.
That's not what's recommended. And it's not the same way of doing it. You don't use compression like you do for a mammogram. You usually go through a scanner, or sometimes you have to lay on your tummy and your breasts.
Yeah, you have to stay still for a long time, and you're in that actual cone. So it's a more intensive process.
There are open scanners if you're a little bit claustrophobic. They do make open scanners that can be used.
But it can make a difference in the
end. Well, you know, breast cancer deaths are declining because of early detection and better treatment. So the trick is to find it early. And say, for example, you've had breast cancer detected in one breast. It's real important to image the other breast because about 10% of the time you're going to get it in the other breast or find it in the other breast at the same time. So treatment is definitely improving, and we want to find out early how involved it is. And so a lot of times before you get surgery, you'll have an MRI too for staging, because we want to treat you early. We want to treat you with the appropriate things at the appropriate time. So this is just one of those ways that we can help women to get screened with mammograms and then add to it an MRI to increase the detection and then increase and make your chances for recovery better with treatment.
Well, thank you so much. It's something for women to consider and ask their doctor and their insurance company.
Absolutely.
All right, thank you, Dr. Elizabeth Salata. And by the way, nothing was wrong with my MRI, so it was fine. Yes.